If you have a chance, just have a look. The two previous lectures were about how you look at C-spines, and then we covered some examples. But because you guys hadn't seen it before, I'll try and go through it a little bit in this one as well. Right? Today was actually just meant to be like a little look at some other types of C-spine pathology and things that you can see on the C-spine. All right. So when you analyze any type of C-spine fractures, right, we follow the lines, which I'll show you guys just now, right? There's the anterior, middle, and posterior line. Then you need to decide, is this stable or unstable, right? Now, in our case, in the A&E, you assume it's unstable. You never take it for granted that anything is stable, right? So in other words, you always immobilize the neck, regardless. Once you suspect there's a C-spine fracture, wherever it may be, we don't take a chance, we always do it. Then you need to decide if you need to go in to do extra investigations like CT scans and things like that, which is most often. And then the other thing you need to know is if your patient is in neurogenic shock. So neurogenic shock is because your patient can't vasoconstrict, right? Because they've lost that sympathetic nerves output, right? So they go into low BPs and things like that. Then if your patient does have neurological deficits, have I determined which ones, and things like that, which we'll go through. I'll show you a little, the dermatome map just now, right? Then have you call the orthopedics, and don't forget to look at other injuries, right? Because isolated C-spine injuries occur, of course, but you may have other injuries. So don't just focus on one thing, okay? So let's look at one. So when we are talking about the lines, basically what you're talking about is, when you're analyzing a C-spine, you must be able to see all the bones, right? So you start from the top. So you have C1, C2, C3, C4, C5, C6, C7, and the top of T1. So you must be able to see that to be able to say it's an adequate X-ray. Right? Then you've got C1, which is the atlas, C2, which is the axis. It has this odontoid peg. All right. And then C3 and the rest all look like normal vertebrae. Okay. So when we talk about lines, what we mean is that it has an anterior line, which follows here along the anterior border. Okay. Middle line, which is just the posterior vertebral body, okay? And then the third line is basically this confluence of the, what you call spinous processes. So you make sure that those are also in line as well. So the most important one is the middle line. The reason being that if the middle line is intact, then at least your spine is sort of saved, And then once the anterior line is next important, and then the posterior line is the least important, but you still have to look at it, all right? So like I said, you guys have a chance, go back to the previous lectures and just see, and then we cover a whole lot of those. So in today's, let's have a look at our spine, all right? So we said we've got an adequate one, and when we follow the lines, you can see the lines are what you might actually in a